Florida voters are being asked if they want to legalize recreational marijuana, but experts have continued to emphasize the need to keep it out of the reach of small children. But what about adults? A brand new study dives into the health impacts of marijuana-infused candies for people over the age of 65. CBS 12's Katie Benty sat down with a local medical expert tonight. She joins us live in downtown West Palm Beach with what you need to know. Katie?
Jim, data shows a shockingly steep increase in the number of seniors ending up in the emergency room with cannabis poisoning. Now, in this case, we are specifically talking about edibles. That means gummies, chips, drinks, all infused with CBD. But why exactly is this happening? Well, that really is the big question here. From pain relief to sleep aid, CBD gummies and edible cannabis have been seen as the go-to remedy for many.
They're looking at it as a vitamin, so to speak, and it's not. And actually, you don't know what's in it. So talk about, flying blind, you're really flying blind.
New research shows a disturbing trend involving these sweet treats and older adults. According to the study by JAMA Internal Medicine, emergency rooms in Ontario, Canada saw a steady rise in visits among those 65 and older with cannabis poisoning. A similar study out of California found that ER visits have increased over 1,800% in the last 15 years. Experts say people often assume CBD is completely safe because it's over the counter, but that's not entirely true.
The supplement CBD is not FDA controlled, so there's no dosage that's accurate. The purity doesn't have to be there. You really don't know what you're taking. So I wouldn't do that.
Dr. Barbara Krantz leads the older adults program at Karen, an addiction treatment and rehabilitation center located in Delray Beach. She says prescription medication can play a huge factor because some drugs don't blend well together.
A lot of people are on blood thinners, high blood pressure medicine, diabetes, antipsychotics, anti-seizure medicine. It will affect those medications, and there can be dire consequences of that.
Cannabis poisoning is known to cause symptoms of dizziness, nausea, confusion, anxiety, and even chest pain.
The bottom line with the dangers with an older adult and CBD is that they first should speak to a physician or at least a pharmacist before they buy it, and don't just buy it in the drugstore or the coffee shop or wherever. Have some thought because they need to know if there's drug-drug interactions.
Experts say that portion control can also play a part in this. Some older adults who take edibles may not be aware of that delayed effect. And then when you reach for another one too soon, it's a risky game of double dosing that could also put them in the ER. Reporting live in downtown West Palm Beach, I'm Katie Benty, CBS 12 News.
I'm Jim Grimes. Click like and subscribe buttons if you want to see more stories like this that impact you.